Hello, everyone. This is Mr. Donati. Today, we are going to look at cardiovascular disease. This is the biggest killer in America in terms of diseases. The most common chronic disease are cardiovascular diseases, which are diseases of the heart and blood vessels. Cardiovascular diseases include hypertension, atherosclerosis, heart attack, arrhythmia, congestive heart failure, and stroke. In order to understand heart disease, you must first become familiar with the parts of the circulatory system. First, we want to look at the heart. The heart consists of four hollow chambers, two ventricles, and two atria. All four chambers work like a pump and push the blood throughout your body. When the blood returns to the heart, the blood enters the right side of the heart. The right ventricle pumps the blood to the lungs where it becomes oxygenated. Oxygenated blood is brought back to the heart by the pulmonary veins, which enter the left atrium. From the left atrium, the blood flows into the left ventricle. From there, the blood leaves the heart to be pumped to the body. This process is repeated during every heartbeat. Also, the heart is made up of cardiac muscle. This is basically a muscle that allows the heart to expand and compress without tearing, and this is the only place in the body where you'll find cardiac muscle. The blood vessels are one of the most important circulatory system organs. Your blood vessels allow blood to flow quickly from one region to another and then allow it to come back to your heart. The size of your vessels increases with an increase in the amount of blood that passes through the vessels. Blood vessels have a hollow area that allows easy flow of the blood. It is called a lumen. There will be a wall around the lumen, which can be thick as arteries or thin as capillaries. The arteries are oxygen rich blood flowing away from the heart to the rest of the body. The veins are oxygen depleted blood flowing back to the heart. Capillaries is the connection between the arteries and veins where the oxygen and carbon dioxide is exchanged. This is an example of internal respiration. The term heart disease describes any condition that weakens the heart and blood vessels and make them less functional. More adults in the United States die from heart disease than any other. About 610,000 people die of heart disease in the United States every year. That's about 1 in 4 deaths. Heart disease is the leading cause of death for both men and women. The risk of heart disease depends partly on age and heredity. However, the most heart disease is the result of lifestyle behaviors such as smoking, eating too much foods high in saturated fat, not getting enough regular physical activity. Teens who make healthy lifestyle choices are less likely to develop heart disease as adults. Again, this is another great example of preventive medicine. We want to look at heart disease. When we talk about cardiovascular disease, heart disease is part of it. Coronary heart disease, this is the deadliest. Over 375,000 people die each year from this. Heart failure, also known as congestive heart failure. Arrhythmias, these are abnormal heart rhythms that can cause the heart to beat too fast, too slow, or regularly. Valvular heart disease occurs when one or more of the heart valves, the mitral, aortic, tricuspid, or pulmonary valves, are damaged or diseased. Cardiomyopathy, this refers to the heart muscle where the heart becomes enlarged, thickened, or stiff, leading to reduced pumping ability. Congenital heart disease, these are heart defects present at birth resulting from abnormal development of the heart during fetal growth. Myocardial infarction, heart attacks, occurs when blockage in the coronary arteries cuts off the blood supply to the part of the heart, leading to tissue damage and death. Precardial disease, this involves inflammation or other disorders affecting the pericardium, which is a sac-like membrane surrounding the heart. Rheumatic heart disease is a complication of the rheumatic fever and causes permanent damage to the heart valves. The different types of cardiovascular disease I haven't mentioned are hypertension, high blood pressure. This one, guys, is also referred to as a silent killer. There are no usually any symptoms. People feel really good, and but yet they have high blood pressure. Atheroscoliosis, fatty substance that builds up in the artery walls. Arterioscoliosis is a hardening of the arteries. Arteries lose their elasticity. Stroke is a disruption of blood flow to the brain. When you treat heart disease, there's a few ways you can do it. First of all, angioplasty. These are teeny balloons, drill bit, or a laser is used to remove the blockage. Medication. A pacemaker creates an electrical signal to control the heartbeat. Bypass surgery. Healthy blood vessels are used to detour the blood around the blockage. Heart valve surgery. Faulty valves are replaced with artificial ones. Heart transplant, completely replace the heart with a healthy one. This is done as a last resort. Risk controls you cannot control. Your heredity. Basically, sometimes heart disease is passed on from their parents to their kids. Gender. Men have a greater risk of developing cardiovascular disease earlier in life and greater risk of having heart attacks than women do. However, research indicates that older women are less likely to survive a heart attack than men of the same age. Age. As people become older, they become more likely to develop CVD as risk increase with age. About 80% of people who die of cardiovascular disease are 65 or older. Risk controls you can't control: exercise, nutrition, substance abuse, stress, and sleep. On a final note, knowing the risk factors you can't control can help you make healthful decisions that protect your cardiovascular system. For example, if you have family history of hypertension, you should be particularly careful to get proper medical screening and to practice preventive strategies such as maintaining a healthful weight. With that being said, I hope you enjoyed the show.